A beautiful day to all of us. I want to welcome you to this class of Introduction to Professional Counseling. I am the Reverend Dr. James Ngedembogwa, a lecturer in psychology and an ordained clergy with the Anglican Church, the Diocese of Thika. We shall be looking at the outset about what is counseling, definition of the profession, what counseling is not, and to define the goals of counseling. This is supposed to be an interactive class in which we share feedbacks, we do our personal development as we have been doing in class, and in which we reflect on our development at the personal level, at the professional level, and basically in counseling, we allow ourselves to be vulnerable from time to time, even as we continue the learning process. Counseling, basically, the term counseling has been overused and is associated with various fields such as advising, the instilling of discipline, and guiding. Some form of counseling could be seen to be part of other professions, such as what we find with doctors, chartered accountants, lawyers, religious persons, and readers. From time to time, these personnel, these people, these professionals are giving some form of guidance, some form of counseling within their professional lines, and you'll find that oftentimes some of them could be referred to as counselors, to be a psychologist or advisors along those lines. We find that counseling is also provided by other helping professional groups such as psychiatrists, social workers, nurses, marriage and family therapists, and pastoral counselors. But for us in this class, for us in this learning process, the critical thing that we may need to be concerned with is the question of what do we want to become. As we help those we serve in our parishes, as we help those we interact with within our family members, as we help those we come into contact with, our desire is to give the necessary professional help, and therefore the need for each one of us in this class. Maybe take a moment or two, pause and ask yourself, why do I want to become a counselor? Why do I want to learn counseling? In my experience, just within the very first few months when I registered to be a student in counseling in one of our local public universities, I realized very fast that the person who needed help was me, even before I extended the same to others. And therefore, ladies and gentlemen, it's a worthy moment of reflection as we ask ourselves on the way forward. Counseling, right at the start, we need to understand what it is not. Counseling may have several barriers to communication. And therefore, counseling, we need to understand, even as we start it off, that counseling is not giving advice. Counseling is not offering solution, because we do believe that every other person comes to counseling or to seek help, sometimes with a way out. All that they need is a listening ear, a caring person to help them. Among the many choices, to help them reflect on each and to make a choice for their lives. Counseling is not moralizing. I realize that many in this class could be drawn from the church arena. And sometimes we do become judgmental, moralize issues, and our clients, when they come to us, you will realize that some of them already know what they are going through is causing their lives, even impacting on their faith, and therefore they do not require further moralization or demoralization. Counseling is not about preaching. We have enough of that when we go to our religious spaces, and therefore counseling should not be a moment to preach, even though we may feel once in a while pulled toward that direction. Counseling is not analyzing or diagnosing just for the sake of it. Judgment and criticizing has no place for the field of counseling. Counseling is not just about merely reassuring that all is well, because somebody could be in deep pain and really want to get into contact with this pain and understand why, and empty reassurances without this person processing their painful episode may not help this person. Counseling is not praising or agreeing. And as we move on, we see that counseling is a professional relationship between a trained counselor and a client. Underline trained. Because what makes us better, what makes us, stand out against all others out there is the training we get. Counseling is therefore that professional relationship between you, the trained person, or the counselor, and a client. Relationship is usually person to person, and is designed to help clients to understand and clarify their views within their life spaces, and to learn to reach their self-determined goals through meaningful, well-informed choices and through resolution of problem. So we find that we help our clients, the people who come to see us, the people who seek our help, to understand and clarify their views. Sometimes it's about questions of life, questions of relationship, questions of deep pains, to understand and clarify their views on this. Sometimes people feel stuck because often you find our clients coming because they are feeling a sense of being stuck in a relationship that is not moving forward, stuck in a work environment in which, to use a word out there being used so often, a toxic environment. And they would want to reach their goals in life. Because part of counseling is helping and identifying goals for these clients, so that together, you, the counselor, and the client explore these goals for the resolution of some of these challenges the client could be having. And therefore, for you, the professional counselor, you help them to make informed choices so that in their ways they resolve their problems. According to the British Association of Counselors 1999, counseling is an interaction in which the counselor offers another person the time, attention, and respect necessary to explore, discover, and clarify ways of living more resourcefully and to his or her greater well-being. It's a time to help explore. It is a time to help our clients discover and clarify, other ways of living so that they make use of all their resources. Counseling is a face-to-face situation in which, by reason of training, skill, and confidence vested in us through training, one person helps the other to face, underline that, perceive, clarify, and solve and resolve adjustments towards problems, according to Williamson and 49, page 92. What we are saying here, a professional person, the one we are calling the counselor, get into a face-to-face engagement, and because of the training they have received, because of the skills they have gained over the years, because of the confidence that is invested in them by this person is able to help the client to face, to perceive, to clarify, to solve, to adjust towards the challenges that they would be going through. Counseling is a warm, permissive, safe, understanding, but limited social relationship. As we move on in this class, we shall be understanding why it is a limited social relationship. There are limits to this relationship. But it is a relationship in which the therapist or the counselor, whenever I talk about the therapist, I mean the counselor, in which the therapist, and in some situations you'll find our patients or our clients being discussed as patients. For the purposes of this class, client and patient is interchangeable and we can use both. And therefore, the counselor, the client discuss the effective behavior that the client could be coming in, including the ways of dealing with his emotionally toned needs and the situations that give rise to them. It's an opportunity, it's a moment for the trained person to help the client who has come face their behaviors, explore on the different ways of dealing with their issues, emotionally challenge them about the way forward. According to the British Association of Counselling 1989, counselling is a skill and the principles, or the skilled and the principled use of relationship, which develops self-knowledge, emotional acceptance, and growth and personal resources. Counseling is also a way of relating and responding to another person's and help this person to explore his or their thoughts, feelings, and behaviors toward reaching a clearer self-understanding. And then help them to find a way out so that they cope more effectively with life by making the appropriate decisions or taking relevant actions. As we give these definitions, what is emerging is that counseling is a helping relationship in which we make or we help or we assist in this interaction to have our client get unstuck out of the challenges they could be going through. Feldhahn and Dryden, 1993, defines counseling as a principled relationship. We use the word principled very carefully here, in that counseling is guided by different principles and limits. And it is characterized by the application of one or more psychological theories and recognized set of communication skills. As we move with this course, we shall be learning about different counseling theories to help us understand human behavior, personality issues, a host of issues to help us in the counseling journey. It also uses a recognized set of communication skills that is modified by experience. The language of counseling is a little bit way different from the language out there because we use deliberate language to reach out to our clients. It also uses intuition and other interpersonal factors to help reach the client's ultimate concerns, problems, or aspirations. With experience, some of these skills get honed, get developed, and get sharpened along the way. Counseling, for most of the times, is a face-to-face communication by which you, the client, the professional person, meet and act in an exchange of communication at a face-to-face level. Let me at the very outset say this, that with the dynamics in our social environment, counseling sometimes may not be face-to-face. We now have what is called electronic therapy, e-therapy, which could employ the use of the phone, which could employ the use of internet, which could employ the use of other e-meetings, and it's still accepted as counseling. And especially with the coming of COVID-19 towards the end of the year 2019, all the way 2020, 2021, 2022, we found ourselves becoming creative in other ways to reach out to clients, and especially because of the challenges that were caused by cessation of movements, closures, controls that COVID-2019 presented throughout the world. And therefore, counseling, though ideally meant to be face-to-face, sometimes we have had to resort to the use of e-technology. Counseling is a time to help the person we are calling the client to make decisions or solve a problem. In summary, counseling is a helping relationship between the counselor and the counselee. Once again, these terms continues interchanging, but all that we mean by the counselor is the therapist, is the professional person, the counselee is the client, is the person who is being helped, or sometimes referred to as the patient. Counseling is also a process of empowering the client while listening, helping, and empowering in a therapeutic relationship. A therapeutic relationship in which we have developed rapport, we have created an environment in which there is mutual flow and mutual exchange of information and interaction, and in which the client, the counselee, feel not judged and feel at ease to share on their issues. Counseling is directed to personal, underline that, social, educational, vocational, and empowerment issues, among others. It is conducted with persons who are considered to be functional within the normal age. And this is very, very important for us because as we shall continue learning in this class, mental issues, psychological issues will always present along the continuum of the mild, the moderate, the severe. The mild and the moderate clients who may be going through issues may function along the normal range. And these are the people who may need counseling or psychotherapy. But the severe or the severely affected oftentimes may not be clients for counseling. They may need psychiatric attention and other medical attention. And therefore, not every other presentation of mental challenge, of breathing challenges, of challenges in life may be indicated for counseling. And this is very, very important because sometimes, and I am speaking to a class that draws a membership from the religious communities, oftentimes the church has been accused of minimizing issues and taking all of them to prayers. And I have no problem with prayers. I'm a great believer in prayers. But there are some areas we need them and we desire them tackled by the medical professionals. Counseling is focused on development and prevention of serious mental health problems through education and short-term treatment. As we move on in this course, we will be talking about something we call psychoeducation. And in psychoeducation, we try to educate community members, individuals, about some of the causative factors that may lead to mental issues, to counseling concerns, and therefore counseling itself is focused on development and prevention of serious mental health problems through that which we call psychoeducation and short-term treatment. Counseling is aimed at facilitating counselees who are mainly seen outside medical settings for these individuals to help themselves by making better choices and by becoming better choosers. Ladies and gentlemen, as we listen to each other, maybe take a moment, pause and reflect. In coming to this class, is this what you wanted? To become a helper, to become an empowerment hub for your clients. You know, to learn the listening and helping and empowering skills, and to also learn how to create a therapeutic relationship. You know, that environment, that is inviting, and that which is non-judgmental, that which is welcoming, is the objective to help individuals deal with personal, socio-educational, vocational, and empowerment challenges. Now, why are you in this class? And as I will speak, are there areas in your life that probably may need counseling concern? In our personal development sessions, we shall be talking and dealing with personal issues of concern that may limit our growth in this class. The features of counseling is specific to the need, issue, and circumstance of each individual client. And what we are saying here is that every other client, even when appearing like to be having same issues, a wife who is going through a divorce and another one who is going through divorce, and both of them come to see you at different times. Their issues is specific because you have to consider their unique environment. You have to consider they are not married by the same person. They are not mothers to the same children. They have not been married the same time. And therefore, what you did with the one who came 1 month ago and what you will do with the one who came yesterday is going to be very different. The issues may look similar, and probably in attending to them, you may be guided by the same theory. But remember, individuals are unique. Individuals come with different challenges. Individuals require to be handled at a unique level. Counseling is interactive, mutually respectful, collaborative process. And what we are saying here is that a mutual exchange is required, in which the therapist is open to the client is open to the therapist. Right at the outset, we have what is called contractual making when we meet clients. And this is the time in which we agree on what is expected of the therapist and what is expected by the client in their interaction. And one expectation is that the client is going to be open. The therapist is going to be open, so that interaction is maintained in the whole meeting. Counseling is acceptable to social and cultural context. And this is very, very important. And this is why we said in the very first point that counseling is specific. And some of the specific things we look at with the social and cultural context. For us in Kenya, a Maasai gentleman coming to sit before a lady for counseling may be a little bit difficult. And if they have made the choice to come, because some could be literate enough for this, and not only the Maasai, any other community, and they could be knowing why, yet still they have reservations meeting a person of the opposite gender. The social settings. Somebody coming from an urban growing place may behave very different from somebody who has been brought from the rural or brought up in the rural community. And therefore, you, the counselor, you, the therapist, have to be very much aware about these cultural contexts. Counseling is also a time in which changes to one's attitude come up. Counseling is done with individuals, what we call individual counseling. It's also done with groups, what we call group counseling. It's also done with couples, what we call couple counseling. It is done with families, what we call families. It may extend even to organizations, and this is what we call organizational counseling. Counseling is a profession that is distinguished by having a specific body of knowledge, accredited training programs like the one you are going through, a skilled organization of peers. Once you become trained, and you get the necessary certifications, we expect you to become members of credentialing bodies, practitioners, to get licensed, and we shall be teaching you about the codes of ethics, the legal recognition, and other standards of excellence, because this is a profession that calls for the highest levels of professionalism. Counseling deals oftentimes with the very minds of individuals, with their very lives, and therefore it cannot be practiced by somebody who is not well trained. In our country and in some others, we do have individuals titling themselves motivational speakers in churches, at the workplace, some little level of and a certificate in counseling, and they go calling themselves counselors. It is becoming difficult sometimes to know who is who. But in Kenya, practicing without credentials from the board, we have a board at the Ministry of Health level in which all should register yearly and then join bodies that approve counselors. Without that, you could be liable to legal proceedings. A profession is a type of job that requires advanced educational training. And I must say congratulations for you who have chosen to come to this class. A profession is a group of people in a learned occupation, the members of which agree to abide by specified rules of conduct when practicing the profession. As I have said, the rules of conduct have already been set. There is a board at the national level and at the Ministry of Health, together with the counseling professional bodies that exist in Kenya towards that. Professional counseling, therefore, is defined as the following. The British Association for Counselling, BAC, may have been the first professional association to adopt a definition of professional counseling in 1986. And they say counseling or professional counseling is the application of mental health, psychological or human development principles through cognitive. When we talk cognitive, we mean the mind. Affective, when we talk affective, we mean our emotions. Behavioral or systemic interventions, strategies that address wellness, personal growth, or career development, as well as pathology. Let me simplify this by saying that professional counseling apply or use our understanding of the mind, our understanding of the human growth process, right from childhood, infancy, all the way through life development processes, and employ the use of our minds, our emotions, our behaviors, so that it addresses wellness, that is holistic wellness. Wellness at the mind level, wellness at the physical level, wellness at the financial level, wellness at the relationship level, wellness at the career development level, wellness even in terms of health. And this is what we call pathology or diseases. Professional counseling is also a short-term theory-based, non-directive, underline that, non-judgmental, underline that process where a person who is basically psychologically healthy and facing adjustment, development, or situational concerns or problems is empowered to gain awareness of their self and their situation, and also to make decisions through the support and assistance offered by this professional person through their relationship. Simply, we are saying professional counseling employs theories. That's why we are calling it theory-based. We are also saying non-directive, non-judgmental. We don't direct people into the choices they make. We do not judge them by the choices they make. Ours is to help them through a non-directive, non-judgmental process. And often the people we address, they are not, to use an American slang, they are not nuts, they are not mites, they are not gone bonkers, they are not mad, but they are basically psychologically healthy. All that they are having is they are facing challenges in adjusting. That feeling that comes. For us in Kenya, I can be allowed to use the word feeling, or maybe simply say that feeling that comes when somebody is facing anxieties, when somebody is having financial challenges, to help this person cope in that kind of moment. When they are having developmental issues, questions that comes in growing up, they are having situational concerns. How do I deal with my boss? How do I deal, in this particular situation? And the professional person empower them to gain awareness of their self. Sometimes by asking simple questions, like when last you faced an issue like this, what did you do? How did you cope in this kind of a situation? And how did you get through? And we challenge them, like, is it possible to do it once again in order to overcome like you did the last time? So the professional person helps this person to make a decision by providing the support and assistance through their relationship. The discipline that roots into counseling is counseling psychology, or the whole area is referred to as counseling psychology. Psychology is the scientific study of behavior and mental processes. By psychology, that which is drawn from two terminologies, psych, the mind, logic or logos, the study of. So psychology is simply the scientific study of behavior and mental processes. Counseling psychology, as a psychological specialty, facilitates personal and interpersonal functioning across the lifespan with a focus on emotional, social, vocational, educational, health-related, developmental, and organizational concerns. What we are saying here is that counseling psychology, we look at the personal and interpersonal issues within an individual across the lifespan, from birth all the way. And some of the areas that will be focused on is the emotional, the social, the vocational, the education, health-related development, and organizational concerns. Counseling psychology will integrate theory, research, and practice. I have said earlier in this class that we will be looking at theories of counseling, which we shall integrate to help us in the counseling journey. A lot of research goes into this. A lot of practice goes into this, with a sensitivity to multicultural issues. And this specialty encompasses a broad range of practices that help people improve their well-being, alleviate the distresses that may going through, overcome any maladjustment, resolve crises, and increase their tendency to live more highly functional lives. In short and in brief, you the therapist, you the psychologist, you the counselor, you the professional person, your work is to help your clients live better lives. On the other hand, even as we reflect on this, and maybe I would want to take a moment and pause and ask ourselves, you may not answer me this, but this far, what do you think you are getting as we move on with this class? I take a moment and I pause. The other term that will keep on cropping up even as we move with these classes is the arena of guidance. There is a tendency for practitioners to confuse guidance with counseling. Guidance can be taken as a broad umbrella which includes a constellation, and this is a totality of services. You know, when we talk constellation, we mean a totality of issues, a totality of services that help in personal, social development, career development, growth, and adjustment. Once in a while, there will be some overlaps because, remember, counseling is not an exact science, an empirical study. You know, like 1 + 1 will always be equals 2. Sometimes there will be some overlaps. And that's why deliberately I choose to help us understand guidance in context. Guidance is a relationship between the unequal, which implies that a counselor provides information related to the client's dilemma, for instance, about choosing a career. You know, in guidance, it's like the counselor is making a choice for the client, because guidance will use the client's aptitude through the aptitude test, interest and personality assessment scores. You know, from the scores, the person will be told this is your area. While in counseling, we challenge them to come up with, you know, a way forward. Guidance may be direct one-on-one session where necessary probes by the counselor are answered by the client. So you'll find once in a while, counselors are also acting as guidance experts, and especially in the area of career development. Guidance also describes an overall school-college program where assistance is provided to students, teachers, parents, and administrators. And that's why in the contemporary Kenyan situation, you'll find that guidance and counseling has been lumped together. And you'll find individuals in the school system who are styled as guidance and counselor teacher. And this is okay because in their training, they were trained as guidance and counselor teachers. But in practice, one needs to be very careful. At what time am I doing counseling? At what time am I doing guidance. While counseling is a process in which an individual who is experiencing a challenging situation requires assistance, usually through private discussions, guidance will center on aiding people choose what they value most. Therefore, counseling is a process in which we give assistance through private discussion, while guidance centers on aiding people to choose what they value most. Towards a focus on helping them make changes. Guidance is mostly information giving, while counseling is mostly change-oriented and remedial in nature. What we are saying here is that guidance, the person giving it will always be seen in the eyes of the client as the expert, as the one who holds all the knowledge, while counseling is about a helper who guides towards change, and it is also remedial in nature. Psychotherapy. From counseling and guidance, we move to psychotherapy. Counseling is about those challenges that we meet in the course of developmental issues, while psychotherapy goes a notch higher and becomes the treatment of psychological, emotional, or behavior disorders through interpersonal communication between the patient and a trained counselor or therapist. From the normal challenges, the mild challenges of life, we get to the moderate, where we may now start having presentation of psychological, emotional, and behavior disorders. And this is where the psychotherapist comes in. A psychotherapist is just a little bit highly trained counselor, psychologist, clinical psychologist who is able to deal with this client. Psychotherapy usually involves a complete change in the personality characteristics followed by a reconstructive process. It emphasizes on the past to understand the aspects to be changed. In contrast, counseling is directed toward aiding our emotional growth and psychological wellness, and thus the process of counseling focuses on the present. A simple differentiation between counseling and psychotherapy is psychotherapy, we shall dig into the past. What happened? How was your family? We want to understand all these aspects. But in counseling, we want to focus on what is exactly happening. Why are you here? A good therapist, depending on what is presented before him or her, will use an integration sometimes of these areas. There'll be moments, even when we are not guidance experts, there'll be moments with training, with expertise, we could give guidance. And the critical thing here is training and experience. There are moments we'll be giving or doing counseling. There'll be moments we'll be doing psychotherapy. And what I'm saying for us in this class is training doesn't stop at this level. The psychotherapists practice independently or in hospital settings while counselors are more associated with educational settings. Emotional and severe personality problems come under the domain of psychotherapists, where the objective is to treat the patient. Psychotherapy in general includes more sessions than counseling. Sometimes counseling, 5 sessions minimum could do. In psychotherapy, a minimum of 10 sessions may be indicated. But don't be unduly troubled, because in this training we shall help you to understand counseling more. But in the future, as you progress, you'll find with experience, with expertise, with more training, that you are offering a high level of counseling which will be psychotherapeutic in nature. And what I'm saying here is that there may be overlap in the practice aspect. For example, the psychotherapist, the counselor, will provide family and marital therapy, counseling for substance abuse, child abuse. Some counseling theories are commonly referred to as therapies as well, and can be used in either counseling or therapeutic settings. And therefore, ladies and gentlemen, a simple table here to guide on the difference between guidance versus counseling. You have these in your notes, which are forwarded. You have it here in this right. But guidance is about advice or instructions on general problems given by someone more experienced or qualified than the receiver. It has a broader scope, such as educational guidance, career guidance, financial guidance, health guidance, etc. Anyone with good experience and knowledge can give effective guidance to others. You don't have to have been to school to give guidance, although training will make it more better. Counseling is professional advice given by a professional counselor based on personal or psychological or psychology-related problems of the individual. Counseling essentially covers personal and psychological assistance. Needs to be done by a professional counselor with a recognized license here in Kenya and in most of the other parts of this world, with a license to practice as a counselor. The nature of guidance is that it is proactive, while the nature of counseling is reactive. By proactive, we mean guidance is usually given before the event happens. In which we sit with our sons and daughters, with our students in school, and we tell them, this is the way. If you pass through it, you shall never deviate away from life. Counseling is reactive. That is, it's given after the event has happened. Somebody has not passed through the way, and they are finding themselves in situations which are challenging them, and therefore they come after the event. The strategy for guidance is that it doesn't have deeper connectivity. While for counseling, the strategy is to build relationship. In guidance, the recipient is the general public. Oftentimes we will do it from church pulpits, in a meeting out there, at the workplace, in a chief's baraza. But counseling is done on request from the client. The scope of guidance is broader and comprehensive. It covers so many areas, from how to rear your cows, donkey, cats, how to keep your car clean, how to maintain your house. It will be broader and comprehensive, and will cover almost every other aspect out there. But the scope of counseling is detailed and immediate. The goal of guidance is self-understanding. Resolution of problem is the goal of counseling. What is counseling about? Counseling may be concerned with addressing and resolving specific problems, making decisions, coping with crisis, working through feelings, and inner conflict, or improving relationships with others. The overall aim is to live more fully and satisfactorily. Counseling deals with wellness, personal growth, career, pathological concerns. Counselors will work in areas that involve relationships. These areas involve intra. By intra, it means within ourselves, and interpersonal concern, interpersonal, my relationship with those others, concerns related to finding meaning and adjustment in such settings as schools, family, and careers. Once in a while we find ourselves lost, and we are asking questions about who am I? What is this that I want in life? Where am I headed? Am I doing okay? And how can I do things better? And this is when we seek the support of counselors. As I said earlier, counseling is theory-based. Counselors draw from a number of theoretical approaches, including those that are cognitive, affective, behavioral, and systematic. These theories may be applied to individuals, groups, and families. Counseling is a process, and I shall keep on repeating this, that it's a process that may be developmental or intervening. About our developmental process, or intervening, coming in when there's a challenge in one's life. Counselors focus on their clients' goals. I wish we would underline this, that it is not about us, the professional persons offering this support. It's about the goals of the clients. So when we meet during our initial meetings, we will set goals together with our clients. This is where I desire to go. This is what I want to be. And therefore, in our interactions, we'll be moving towards helping them meet their goals. Thus, counseling involves both choice and change. In some cases, counseling is a rehearsal for action. Counseling ethos is one of facilitation rather than advice giving or coercion. What we are saying here by ethos is counseling practice. The engagement, we facilitate change. We don't give advice. We don't coerce. It could be a brief or long duration. Counseling could take place in diverse settings, the organization, the private practice setting. It could overlap with practical, medical, and other matters of personal welfare. We need to be practical. There are times counseling is given in hospital beds because somebody is admitted and they have other medical concerns. There are times it is given at the organization because there are organizational concerns. There are times our clients will come at our practice, at our private practices. Types of counseling include the informational counseling, in which a counselor shares a body of special information with a counselee. When we just share information, it could be situational or related with what is happening at that particular moment in the lives of our clients. It could be psychotherapy for people with needs so specific that they can only be met by a trained physician or psychologist. We go back to a little bit of where we started and remind ourselves that counseling is not telling or directing. Counseling is not giving advice. Counseling is not a casual concern. Counseling is not a confession. Counseling is not preaching or praying. Counseling is not solution giving. Counseling is not fault finding. Counseling is not interrogation. It's not a business. It's not about patronizing, patronizing in which we approach our clients with that know-it-all attitude, believing I am the epitome of knowledge. I hold a monopoly of knowledge. No. It's not prejudging. It's not prescription giving. It's not blame shifting. The differences between advice, guidance, and counseling. Advice is mainly a one-way exchange. It is giving an opinion. It is making a judgment and recommendation. If I would say in Kiswahili, for those of us who would understand Swahili, ni njia ya mpito tu moja. One way, where we find in traffic, gari zinaelekea tu upande moja na hakuna kupitia hiyo barabara ukirudi. Inaenda tu upande moja. A one way. It's not about giving an opinion. It's not making a judgment recommendation like we may find in advice giving. Guidance is mainly also a one-way exchange. Wakati tunaambia watu, lazima ukapitie hapa. Guidance is showing the way. Guidance is about educating, influencing, and instructing. While counseling is a two-way collaborative process. Gari yaenda upande ule, ingine ya kuja upande ule. Tunapitana katikati. Collaborative process in which we learn to give way, in which we learn to listen to the other person. It is a supportive relationship that enables clients explore their problems, understand their problems or challenges, resolve or come to terms with their problems. We are just there. Sometimes counseling is about providing a willing ear to listen. The ministry of presence, like we talk in the church. The benefits of counseling includes it helps the counselee to be contented, enables one to be creative, increases competence in the counselee. It has aspects of personal growth, psychologically, emotionally, socially. It helps our clients to face difficulties. It helps them to assess part of their personal resources, the talents, the intellect, the attitude, the potential. It enables counselors to respond to the challenges of life. Whatever issue that happens under the sun, according to the preacher in the Bible, our brother Solomon, he says nothing that happens has never happened under the sun. There is nothing new. Whatever pain we may be going in a moment, whatever challenge we may be going through a moment, it has faced humanity. And therefore, counseling is that opportunity to help our counselees to respond to the challenges of life. And therefore, in counseling, there will be the need to set goals. Goals are the desired end toward which some action is directed. Without set goals for our work, it is very possible to miss the point for your work. Even as you woke up in the morning, you had something you wanted to do in the day. A destination, some work to accomplish. By the end of the year, by the end of the month, by the end of the week, we have some goals. And therefore, counseling also is about goals. The counselor works collaboratively, and this terminology we have used it severally. Collaborative, together. with the counseling in setting personal goals. Why are you here for this session? What would you want to accomplish? You tell me about challenges at your workplace. I hear you talk about challenges in your relationship at home, with your husband, with your wife, with your children. What is it that you would want to accomplish out of our interactions? They will talk about, I would want my marriage to be this way. And it is your work as a therapist to insist on smart goals, smart focuses. The goals need to be realistic and governed by the presenting concerns or problems of the counselee. The personal goals are essential in collaboration, successful intervention, and outcome. If you have no goals in the therapeutic interaction, you would rather call off the counseling engagement because you won't be going anywhere. The goals helps in collaboration, successful intervention, and outcome, because against those goals you'll be checking progress. As you release your client to go home, you will be challenging them with homework. And when they are coming, there you'll be reviewing, what did you do? What did you accomplish? Setting goals help one remain accountable for the things they want to achieve. The goals of counseling may be diverse, but the most common include self-awareness and insight. This is usually sayable very well in the Swahili language. For those who may not understand Swahili, I'll still put it in English. Self-awareness is about kujijua, kujifahamu, kujielewa. Tunawasaidia wateja wetu ambao wanakuja kuhudumiwa, kujijua, kujifahamu, kujielewa. To know themselves, to understand themselves, to have an increased, deeper understanding of what they are going through and to develop insight. Another goal of counseling is support and empowerment. A place where they can come and cry without judgment. A place in which, what they were a little bit afraid about, those ghosts in their lives, you help. You, the professional person, you help them deal with them. And I usually say when we are growing up, we grew up in those African mud walled huts, and there was no electricity. And any time upon entering a room in the evening, there was always the fear that a rat, a snake, a frog could be lurking in the dark. But something interesting used to happen. If you had a torch, if you had the hard-held lamp, and it was on, and you entered the house with it, or it was put on, or it, somehow, all those fearful creatures used to disappear. And later on, as we grew up, we came to realize that all these were creations in our minds often. Empowerment is about helping your client deal with those scary creatures, those scary fears that they would be having in their mind. Counseling is about facilitating behavior change. And your clients come knowing the way forward. They only need your support in enhancing their behavior change. Counseling is about improving ability to both establish and maintain relationships. It's about developing the ego strength to enhance effectiveness and the ability to cope. Counseling is about self-actualization. It's about helping promote the decision-making process while facilitating one's potential. Self-awareness and insight, as I have said, it entails helping a counselee begin to understand himself or herself. Self-insight is the understanding of self in some depth. It's about facilitating a conscious knowledge of one's character and feelings and the effect of these in a person's mental processes and behavior. It helps the counselee understand why they think, feel, relate, or behave in a certain way. Self-awareness overall aim is to help this person discover their real self and their growth potential. In support and empowerment, empowerment entails giving power to the powerless so that they can facilitate their wellness. It is based on a belief that clients are capable and have a right to manage their own lives. They are able to come up with alternatives and solutions to their difficult problems, but sometimes they do not have the courage to act on what they know is right or to make significant decisions that may bring imbalance. Giving them their life back in their hands so that they take control. Counselees also need empowerment to move on in the right direction and from the stalemate where they feel stuck and afraid to take a step. Like me and you, once in a while we get stuck, and especially in the issues of relationship. Did I make a mistake here? Am I making a mistake here? The issue of a job. Am I sticking in a toxic environment? Do I need change? Through support and empowerment, the counselees can be helped to meet their goals and cope through difficult situations in the present and in the future. Behavior change, another component, is about facilitating a change from maladaptive behavior to healthy ones. Our clients come knowing I'm not doing okay. And our work is to help or facilitate them toward change. As we move on, this class will be looking at the behavioral theories, at the cognitive behavioral theories that could facilitate some of these changes. People often and sometimes are caught up in a behavior that constantly sabotages their success in life, in their relationship or their work or study, which leaves them constantly feeling that they have failed in life. Somebody is in an abusive relationship, but they continue defending the behavior of their spouse. Oh, so-and-so, daddy to so-and-so is such a gentleman. It's only that when he drinks. It's only that when I ask a question, he changes. And they continue in those abusive relationships. And they sabotage their success and their movement. In counseling, we empower them to make changes in their relationship. Behavior change is about helping a counselee learn new ways of doing things that are fulfilling. He or she is encouraged and motivated towards behavior change so that they can appreciate life and the things that they go through. The ego strength. This refers to the healthy, adaptive functioning of the ego, that is the capacity for effective personal functionings. The counselor aims at enhancing an individual's ability to maintain their identity and sense of self in the face of pain, distress, and conflict. This is where we help a person to get or to find themselves, to get unstuck, not to feel lost, and to discover their identity. In the face or in the instance of pain, distress, and conflict. We help the counselee develop his or her thinking, feeling, and perceptive abilities so that they can cope with life more effectively. Which we keep on asking, how else can you handle this? I hear you say that your son ABCD and causing you a lot of pain. How do you think, or what do you think you may need to do to have him change? Or what do you think you need to do for you to change so that this behavior changes? A change thinking, a change perceptive of feeling and thinking and seeing things. Because sometimes we only need to take 2 or 3 steps back and ask ourselves, what do I need to do about this issue? A healthy ego strength enhances a positive self-concept in which we accept ourselves. Sometimes we walk with the feeling, I'm thin, I am fat, nobody loves me, nobody likes me. And in Swahili unajikuta saa zingine unajichukia. No self-appreciation. Ego strength is about developing a positive self-concept in which one think I can, I will, I shall, I must, and also believe that I may not be what I have been thinking all along. It builds resilience in times of adversity. Ladies and gentlemen, as we continue, maybe once again take a moment and ask yourself, how am I doing this far? What are the lessons that I'm getting in this interaction, in this training? Self-actualization. Self-actualization entails helping counselees find their gifts, talents, and areas of strength and develop these to full potential. Discovering what I'm good at. In this area and in this disposition of the TikTok, new gifts are coming. Once upon a time, we used to hear, go to school, get a degree, get a job. The youthful member of society are saying, no, I may not necessarily need to go that route. I just need to have a diploma, just the rudimentary training to speak English and another language, and I'm good to go with TikTok in the house. And they are making money out of their gifts and talents, discovering areas of strength and developing those to full potential. What is this that you like doing most? Is it farming? Is it dancing? Is it preaching? Is it teaching? And the client is helped to actualize on that. The counselor facilitates realization and living out their unique human potential so that the counselee is able to fully take advantage of his or her talents while being mindful of their limitation. A time in which one is helped to enhance a desire or motivation for self-fulfillment and realization of one's full potential. Integration, this means the enhancement of the ability to incorporate more aspects and consider their effectiveness in enhancing unified wellness. We are not just one lump of clay. In us, we have different gifts. In us, we have different dispositions. So how can we integrate all these for the very best? This idea, because I'm a reverend of the church, that the only thing I can do is stand at the pulpit on Sunday. What else can I do? We try to help our clients think outside the box, sometimes minus the box, in creative ways to integrate all our gifts and, use them for our benefit. It helps the counselor to become an integrated intrapersonally and interpersonally person, taking up responsibility for their own choices, emotions, thinking, relationship, and life. In which our mind, we understand very well, our bodies, our psyche, our spirits, and we are able to work in tandem with our holistic being. And of course, for us believers, listening to the voice of God. Counseling is also a time to help the individuals increase individuation and differentiation. Even when we are human beings, we have our own unique and individual calling. What we call individuation, me the individual, my unique differences. Even within a family of 10, I will always remain me. Individuation refers to helping a person find their true self and differentiation. I find this happening so much in the disciplined forces, in the church, and especially among the clergy, in school settings, in which we are all supposed to think the same. We are all supposed to sing the same song. There is a vision, there is a mission for all these institutions. Yet, we are supposed to think the same. It can never. Individuation is about me getting in touch with my true self and being aware of my differences, even in a family, even in an organization. And counseling helps me to exploit that. Individuation and differentiation helps the person to learn how to separate their emotions and their intellect. That awareness of this is now my emotions. When people are falling in love and they say love is bright, but the intellect will actually say love is not bright, because that moment I discover I'm seeing, I may start seeing something different from what I had conceptualized. So we get into love even with our intellects. And therefore, not to be caught up in enmeshment with the family members or members, or to be too disconnected from them. When we are not our true self, we may get into what later on in family therapy, if you continue with this program, we learn is called enmeshment, in which daddy and mommy are so enmeshed into each other that sometimes there is nobody giving direction. The children have no unique identity, and they are having issues and getting sick along the way. Yet, individuation and differentiation needs to be carefully attended to, so that we also don't become too disconnected from those others. The purpose of counseling is to help clients manage their problems more effectively. And by problems, the key word we use nowadays is challenge, so that we don't end up being very judgmental. So it is to help clients manage their challenges more effectively and develop unused or underused opportunities to cope more fully. All of us have opportunities that we can exploit, given that supportive hand. Counseling is also to help and empower clients to become more effective self-helpers in the future. These may help in enhancing constructive change and making a substantive difference to the life of the client. Constructive change can be measured by an increased self-understanding and self-control, as well as by decreased emotional distress and progress toward self-identified goals. Constructive change here is measurable by how we develop self-understanding, how we develop self-control. Are we getting more in touch with ourselves? Are we getting more self-control? Is there decreased emotional distress? And therefore, if these are noted, then we can say we are growing, we are developing, we are changing. The role of the counselor finally for this particular meeting. The counselor role is to facilitate the client's work in ways that respect the client values, their personal resources, and capacity for self-determination. What we are saying here is that the client has their values. As a Christian, as a member of this particular community or tribe, they have their personal resources, that within every other individual there is what God has gifted him or her. And our work is to help for us to help them rediscover this, dig and probe and explore. And they also have the capacity for self-determination. Everybody, deep down in the conscious, they know the road they want to take. Ours is to encourage them upon their journey, if it is the right road. A counselor facilitates effective change or enhancement of well-being in persons with emotional and psychological difficulties. Like I have said, we are facilitators of change. He or she helps in the exploration of the difficulty the client is having, the challenges they may be going through, their dissatisfaction with life or loss of sense of direction and purpose, and help them rediscover themselves. It's about offering some light that will illumine their ways. It's about that supportive hand to lift so that they may find their footing again. And that's why we call counseling a helping relationship. As we move on, probably for our learning activities, read widely, define what counseling is, guidance, and psychotherapy. Read and discuss what counseling is and is not, and help ourselves and yourself deal with the misconceptions between counseling, guidance, and psychotherapy. Read and understand and explain any 5 goals of counseling. And if you have any questions or comments, you can always reach to me. Thank you. Enjoy your times, enjoy your day. Let's continue learning together. God bless.